What do you do when one of the world's leading experts in women's health says yes to coffee from JFK Airport on her way back from Greece?
You make a pot of coffee and push record. That's what you do.
Meet,
That's what you do.
meet Dr. Diana Bitner, author, speaker, chief medical officer, and co-founder of True Women's Health in Grand Rapids, Michigan.
Welcome to Coffee with Steve and Margot. I'm Steve Drake.
And I'm Margot Drake. Good morning, Dr.
Good
Bitner.
morning. Glad to be with you guys. Thanks for having me.
Welcome home from your big trip.
Thank you.
You deserve
Honored to
it.
be here. Yes.
So tell us who you are and your favorite thing about West Michigan.
So I'm Dr. Diana Bitner, born and raised in Grand Haven, Michigan, and work in Grand Rapids, Michigan. I'm an OB-GYN, wife, mother, outdoor enthusiast. I love to cook, and I love what I get to do at True Women's Health. So I get to take care of women. I get to help them find their personalized wellness. And what I love most about West Michigan is it's my people, it's my family, it's my friends, my dear friends, Margot and Steve, but it's where I've grown up. It's where I've practiced medicine, delivered babies, taken care of women. It's home. I love West Michigan.
For you have taken care of women for how long?
Since 1992 in Grand Rapids, Michigan. So I'm honored. So I graduated from medical school at Wayne State in Detroit and came to Grand Rapids for training. So I started taking care of people in Grand Rapids in 1992. That's crazy.
And I am one of those women, and I am a true fan. You can see my mug.
Honored. Thank you. But seriously, I get to be a part of women's most sacred moments, you know, whether it's having their baby, or I remember being with women in the ER who are scared and sick and in pain or bleeding, and get to help them through really difficult moments. And all of that's brought me to where I am today as co-founder of True Women's Health.
And I love your tagline, healthcare for women by women, and also healthcare for all women.
For all women. We want to reach as many women as possible because we believe that all women deserve a healthy midlife and menopause, a healthy hormonal shift, a hormone, transition after babies, to get healthy, to have babies. So we specialize in hormone changes and also weight management and metabolic health. So we just love what we do.
And it shows. It shows through you and every single one of your team members. So what makes True unique? I know.
Okay.
Everybody else needs to know.
I think it's our going deep. We spend time going deep into the why. We know women want to know why they feel how they feel, and we're able to use all their factors such as family history, pregnancy history, their personal habits, and then put that together to help them make a plan to get where they want to be. So it's that deep dive. It's the time, it's the care. We want to be the doctor in your family. We want to be that trusted resource for you when things maybe aren't so great, but also to help get you to where you want to be.
And the way that one of the reasons why I love True is that you take a proactive approach, not a reactive approach, and you're constantly arming your clients, your patients with tools. This is something so simple, but these are your seeds, as you know, in a bookmark. And I don't know if you can tell from here how well loved this bookmark is. I need to pick up a new one.
Well, I think a lot of us are list people, right? We want to know what are those basic things we need to do. And what's on that bookmark are the seeds, right? The 7 essential elements of daily success. And we all need reminders. So when we have a cup of coffee, we have an extra glass of water. Even if we're flying, we make sure we catch up on our sleep. We make sure we're getting good nutrients and not a lot of sugar. So again, it's focusing on those basics, which is the foundation, of course, of health. And then we can potentially add therapeutics on top of that.
Isn't it a little different for a doctor to talk about all those things that actually make you healthy instead of just treating the ailments?
It is, and it's what we call goal-based care, right?
Yeah.
It's looking at a person as a whole person, not as a problem. So it's not, oh, that's a heart attack sufferer. That's someone who had a heart attack, right?
Right.
So we look at it's a person with a story. And then how do we, again, help them get to where they want to be? And it's a combination of all factors. A lot of time it's just listening, right? A lot of times it's just being there without judgment, without shame. If people are still smoking, we talk about how that fits into their lifestyle, and when and if they decide, then okay. But we care for people with their whole self, with all that comes to the table.
Well, I think that's definitely special.
It is. And I love the idea that you gave me of picture of self. Do you want to talk a little bit about that?
Sure. I mean, I think in pictures, and I always thought for myself, like, how do I want to be at a future event? And that's really stuck with our patients, is asking them, how do they want to be? And this system sticks. And I want people, if they come to True, no matter who they get to see, any one of the healthcare providers, you'll see it True, all of our team members, we have the same approach. We want to ask you, how do you want to be in the future, and then support you to getting there.
And you, again, have tools. So I want to age like that.
So this book is the story of the pilot study. So I wanted to make sure what we're doing is science-based and it really works. So back in 2008, if you can believe it, we had the pilot study of our program called Waypoints, and it really worked. Women were happy. And the book is the story of the women who went through that initial pilot study. So people can get a sense of what we do at True by reading the book, by using the workbook. And now I'm excited to tell you is that we now have a basic wellness course that women can sign up for on the website. So they go to truewomenshealth.com, go to resources, and in the drop-down menu is the wellness course. So to sign up for this course, it's access to our materials and to really be able to walk through how you want to be in terms of your midlife, menopause, and sexual health.
Oh,
Very
that is
exciting.
phenomenal.
And that's really how you can touch more women in your practice, is these kind of tools, right?
Exactly.
Yeah.
And
We want to scale.
This book is so well loved. It's dog-eared, it's bookmarked, it's highlighted, and it's written in.
Well, again, very honored, but the fact that that touches you and maybe differently than it would touch somebody else. So again, we just love how we can personalize care, and we're just real, we're normal, right? So when people come in, they're like, I just feel like this is family. This is just normal. And that's how we want to be. Just like you guys. You guys are amazing.
And thank you. Likewise. And you have such a beautiful space also. The waiting room is different. Everything about True is different, and in such a great way.
I always ask people when they walk in and they're there for their first appointment, I said, how did it feel just to come in the door? And they said, it feels like I can exhale, right? I can just be, this is a peaceful space. It feels like a spa. It just feels calm and peaceful. And that's what we wanted to give to people.
So you put this beautiful, safe environment, spa-like environment on top of an amazing team, on top of all of these tools that really reach beyond your visit and really take what you are teaching and suggesting and working with the client in the office home with them. And so you also have a complete wellness program. And this is what my book has been from the office, always working toward that picture of self for a future date. So many great tools.
Thank you. We wanted to make sure people had that all in their hands because it's a lot, right? We talk about wellness in 10 areas, including ability to be active, all the way through heart health, cancer risk, onto sexual health. So all of those things are together. It's a lot. When people come in, they're like, whoa, I've never thought of health like this. So we wanted to make sure it stays really organized, and people are walking out with something in their hand that they can reflect on and think, how does this apply to me?
Absolutely. So I think did you have something that you wanted to say?
No, I think it's nice that one of your patients said, I never thought of health like this. That's like a pat on the back right there.
It's truly an honor. And we want to change healthcare. We want to change how people look at their health.
You are. You have been. So I think this is a great time to get the slide on the screen that tells people how to get in touch with you. And that is at truewomenshealth.com. You can key that in or scan the simple QR code that we have on the screen, and you can get to all of their social media accounts also from truewomenshealth.com. It is located at 2144 East Paris Avenue, Suite 230, and that is right in Grand Rapids, Michigan.
Good old West Michigan. We're here to stay.
Good old West Michigan.
And we didn't even talk about one of your other tools, and this is available. All these tools are available on your website, along with the class that you talked about. We didn't talk about the sex deck. So do you want to end with that? And then we have a couple of things that we need to say before we wrap up.
Well, the sex deck is a card game that I invented to help us make the conversation around sexual health easier. So it's great for a provider to talk to a patient to really have some thinking about what does sexual health mean and what are the reasons that their sexual health might not be where they want it to be, but also then to take it home and talk to the partner about sexual health. Like a lot of times it becomes a blame game, it becomes difficult. So we just want to make it easy. So the sex deck is a wonderful tool. It's good for some laughs. It's good for some ease and comfort around a sometimes awkward conversation.
Yeah, just the conversation. And you have a wheel also.
We should have led with the sex deck.
We should.
Yeah, that was such
We could do a whole nother segment on
blew
it.
it. Time out.
I knew I had my wheel. And so you have just pioneered all of these tools and all of these things. And thank you. We've got the Symptom Circle. This is available on your website as well.
It is.
I understand.
It is.
So good. You are changing the face of female health. Thank you so much.
Right here in West Michigan.
Thank you.
And
Right
your
here in West
expertise makes you travel all over the world because everyone wants to hear you speak in their area of the world. And then you come back home to West Michigan. So
Very
thank you. We're honored to have you, and we're so proud of you.
Thank you very much.
Grateful you are in our lives. I'm getting teary. Let me get through the end. If you are watching on YouTube, don't forget to subscribe and click the bell so you never miss an episode.
And if you're watching on Instagram, Facebook, or LinkedIn, make sure you push follow to stay in the loop for all things West Michigan.
And thanks for watching this episode of Coffee with Steve and Margot. Thank you, Diana, for making time for
Thank
us
you, Margot. Thank you,
at the
Steve.
airport.
You're welcome, Diana.
Thank you for amplifying all of West Michigan. So we're lucky to have you.
Well,
It's
you're
our
one of the
pleasure.
ones that makes West Michigan cool. So thank you.
So
pleasure.
cool. And you are cool, and you make West Michigan an extraordinary place to call home. And we always end our episodes with plant good seeds. Remember to plant good seeds. And that is a perfect segue for your seeds too. So you're always planting good seeds, whether it's in your health or your business or your future, your investments. So important to keep planting those good seeds. Until next time, take care.
Thanks, Diana. Bye-bye.
Thank you.